No, I think with today's announcement, what you just heard, that we'll be, we'll be wearing masks in this State House, and then we'll be asking people in the state of Rhode Island that work for the state of Rhode Island to wear a mask indoors.
So you recommend that people, even if they're fully vaccinated, wear masks?
We're going to follow what Dr. Alexander Scott just laid out, and as a result of today's announcement, that's why I've got a mask here, we'll be asking I'll be talking to our Chief of Staff, Tony Silva. I talked to him before I came over in terms of how we're going to relay that message, but the message is going to be that if you work for the state, that you'll be wearing a mask.
And are you still considering at all a mandate, a vaccination mandate for state workers in general, not just health?
We're in discussions with the different union representatives right now.
All right, over here.
Dr. Alexander, thank you. Dr. Alexander Scott, good afternoon. The Rhode Island chapter of the American Academy of Pediatrics wrote a letter to every superintendent in the state basically saying that they should implement a mask mandate for all students 12 and under. Your thoughts?
Well, we very much appreciate the leadership and partnership of our Rhode Island AAP colleagues. From a public health perspective, it's always important to make sure that every entity, all employers, institutions, have at their fingertips what is going to work best in protecting their staff, the families that are engaging with them. We know what the CDC has recommended. We're here ensuring that everyone is equipped with that information, and we appreciate our Rhode Island AAP colleagues helping to ensure that the school community has that as well.
There are some districts that have already said, or at least considering, that they'll just not implement any kind of mask mandate even for students 12 and under. What's your message to them?
Just really having the information to understand how valuable masks can be. We're talking about the Delta variant. We're talking about a population of children who cannot be vaccinated, and the understanding that masks are another layer that will help us in curbing the spread. We want to support school communities and how they implement it, but it's important from our standpoint to make sure they have the information and understand why it's valuable, and that the parents and members of the school community have that information as well and can help engage with RIDE and the school community leadership to get what's best for them and for their families.
Great, we're going to go over here next. Dr. Alexander Scott, can you talk a little bit about what you're seeing in terms of pediatric cases, what you are hearing from your colleagues in the emergency department? Are we seeing more children getting sick with the Delta variant, and especially children under 11?
Thank you for that. We know what's happening nationally, where there are starting to be increases in younger individuals. What it really points to is populations that are not vaccinated. And so it allows us to reinforce for all those 12 and older, you have the tool, go ahead and get vaccinated. And then also reinforces for those younger than 12 who are not yet eligible for vaccination, the value of having the other mitigation steps in place to keep them protected. We're still early on in terms of seeing the data locally in Rhode Island regarding hospitalizations and children, but we don't want to wait for that. We know what can work. We want to support parents, families, school communities, everyone in having the tools they need to make the right decision for themselves.
Do you know if there are any babies or toddlers or young children hospitalized because of COVID?
I would have to get back to you on what the census looks like right at this moment, but it's still early on before we're seeing. And, you know, we are a well-vaccinated state. It's why we want to really continue to push amongst the people who are eligible for vaccination. That is a critical tool to help ensure that our children stay protected.
Thank you. Back here.
Governor, good afternoon. You said a couple of weeks ago that you weren't ready to pull an alarm unless there was a fire. Hospitalizations down, you know, percentage, testing positive, relatively good. What numbers would alarm you enough to pull a fire?
Well, again, to me, it's always been about the hospitalizations and the death rate. And so, you know, that, as Dr. Alexander Scott says, it's stable, and we're going to do everything we can to keep it stable, and we'll react to the situation, and we'll follow the health department's lead on issues as we're doing today.
And just as a follow-up to Bill's question, why no mandate, if you feel that strongly, to schools? Because what we're hearing from the communities is there's parents groups meeting, they're putting pressure on their school committees. They feel that the mask wearing for kids is going to be onerous this fall. The superintendents have said, look, if the state feels strongly enough, do a mandate. Look, you know they take the path of least resistance. You start talking about liability, and they're all worried. But you're stepping up to the cliff, but you're not going over it. Why are you not telling them? Why are you not mandating rather than strongly suggesting?
Well,
What would you say to those superintendents right now? I'm a superintendent. I'm not going to have a mask policy. What would you say to them?
I would expect the superintendents to follow the CDC guidance.
Which means they should be wearing masks.
They should be following the CDC guidance. That's what we strongly
So
recommended
then
a
why
few weeks
doesn't the
back.
state just mandate it and take that onus off of them?
Well, I'm not sure that, we may have to huddle with the health department. If what we're doing with the vaccinations on the mandate and the healthcare workers is going to come out of the health department in terms of their, you know, their role in terms of, you know, in terms of meeting a health issue. So you'd have to kind of make that determination. We may have the authority in the governor's office to do another mandate, but we may not. And, but we know the health department does if it rises to a level of critical nature in terms of a health issue. So we'll review that. I'm sure that the health department will be reviewing that.
Hi, Governor. Do you support mandatory vaccinations among teachers?
No. We may, but I'd be interested in seeing what the president of the AFT is talking about in terms of engaging in that conversation. But one of the things that we did at a point in time when it was not, you know, 100% popular, but we have our teachers vaccinated at 90% in the state of Rhode Island. We have the working staff in our schools at 90%. And we also have the child care and the child care workers. They've reached the level that we're looking for on a statewide level, which is 90%. So we'll continue, everything is under consideration. But the teachers have already stepped up and got vaccinated, right? They took advantage of the vaccinations. Now what we want to see is the student population do this, to follow the teacher's lead.
Also, do you plan on opening any closed testing sites or expanding testing? And do you expect there to be a booster campaign? And who will that include?
Yeah, I'll let Tom handle that.
We do. So we've been monitoring the demand daily over the last several weeks, and we know, you know, what the requirement was going back to the peak of our cases in the wintertime. So I would anticipate, you know, we're going to open up some additional testing sites, because one of the things we want to make sure too is not just enough appointments available statewide, but enough appointments available that are easily accessible. So we're actually expanding some of our capacity beginning tomorrow. We'll be able to have about just over 5,000 appointments a day at state testing sites on top of pharmacies and others. And we want to make sure that we can control everything we can for the start of school, and one of those is our testing capacity. So we'll make sure that's as easy and seamless as possible. So we'll continue to build that up. With regards to boosters, we've been planning for from day one to be prepared to administer booster doses. So we have several plans already prepared based on whatever guidance we might get from the FDA. We've been watching what they have been doing internationally. I'd say we're prepared to administer a booster if it's decided that it's needed to every single Rhode Islander.
Okay. And lastly, Dr. Nicole Alexander-Scott, we haven't seen you at these press briefings for quite some time now. Do you think that was a responsible approach considering the state that Rhode Island is in, and why did you decide to do that?
So thank you for that question. You know, from a public health perspective, it's always important to get the message out and to make sure that people are informed, have the data and understanding of the science that's there. This is one of many ways to do that, and we can guarantee, as I've said, we are always going to ensure we are accessing every mechanism possible for people to you know, have the information that they need. So if there's a desire to have it more through this, route. That's something that we are ready for, being able to put the message out online, radio, other mechanisms. We want to use whatever will work to ensure people understand the seriousness of the Delta variant, know the value of getting vaccinated if you are eligible, and how that can help protect the children as we're reopening schools safely, as well as preserve our economy that has opened well. And we'll keep doing whatever it takes to get that message out and make sure everyone has the information they need.
Thank you, right here.
Yes. Dr. Alexander Scott, you talked about the Department of Health working at 110% levels. I've heard from a number of people that the people are approaching burnout, and there's not enough support, emotional support, for the type of efforts that's being done. I was wondering what type of state resources are available to support the frontline health workers and also the people at the Department of Health in terms of their enormous efforts to work on this coronavirus pandemic.
Yeah, it's a great question. Particularly, our colleagues at the health department are my heroes, with what they have done, what they have sacrificed for their families and otherwise, and how they continue to move forward in spite of being tired or, just having exhausted many hours and days or skipped vacation or whatever it has taken to make sure that Rhode Islanders are healthy and safe. And it continues to remain a top priority for us to understand what other resources are there. We're learning, every day how this has impacted frontline workers across the board, and determining what types of tools there can be in place to provide the emotional support, the encouragement, the appreciation for what our staff have done, and so many others throughout this response. So it's a top priority, and it's one we'll continue to focus on for quite some time.
Governor, you talked about an October 1st mandate for healthcare workers who are working in state licensed facilities to be vaccinated. How do you define state license? I'm assuming it's state hospitals. Does that include group homes, and what else?
Yeah, nursing homes. We've met with the nursing homes. They're expecting this. You had Genesis that actually came out last week as a national group talking about mandating their staff get vaccinated. So, yeah, it's any health organization that's licensed by the state of Rhode Island.
So that includes the state hospitals?
Yes.
What happens if people are not vaccinated by October 1? Do they still have employment?
Yeah, well, we'll deal with that if, in fact, that happens. I'm not expecting that's going to happen. The comments that I'm receiving from people are supportive of that nature. And I would say, too, is that, look, that's an area we need to pay close attention to. And we are. Our cumulative numbers may not look all that strong when you take it, from the beginning of the pandemic to now on death rates and hospitalization rates, which gets continually reported. But that's not the snapshot that we have right now. So we want to keep it that way, and we're going to do everything we can to keep it that way. And clearly, we do not, we know that there are some staff members that are unvaccinated, and inside of our hospitals, the congregate cares, our nursing homes, we're going to mandate that because we know that that's an area that is at a risk, and we don't want to take any risks.
Thank you.
Thank you, right back here.
Yes, I have a question for Dr. Scott and then Governor McKee. Dr. Scott, there was a recent story in the New York Times that said, regardless of section of the country, there's 15% of the population that won't get vaccinated. That number has not budged. So are you giving a false hope? Just a short time ago, you said Rhode Island, let's get to 90, 95%. That defies national averages of studies that, for different reasons, religious, whatever it may be, there's 15% of the population that will not get vaccinated, and it doesn't seem to be a matter that whether it be you or a politician is going to convince them.
It's always our responsibility to strive for the best. This is not the first time that there has been a public health need, whether it's seatbelts or smoking or otherwise, where our number one focus is always going to be to achieve the goal that's going to keep as many people safe as possible. What we are seeing nationally and what we are staying ahead in now is helping to put policies in place that allow for the path of least resistance to be getting vaccinated. That can help cut down on that 15% number. And with Rhode Islanders, we have always led the nation in immunizations, from children through to adults. There's no reason why we can't achieve what we've put forward. New York Times is referring to the nation as a whole. They didn't have in mind what Rhode Island has accomplished over the years and what we know we can do if we work towards it together.
And Governor McKee, there was a recent television story, I think it said either 30 or 40% of firefighters in Providence are not vaccinated. As governor, would you consider some kind of a mandate? All first responders should be vaccinated by a certain date.
Well, yes, I would consider it. Would I do it? I'm not sure that we're going to go that route, but we're considering all the options right now. And to your issue of, can we get to 90%? I see it. I'm pretty good with numbers, and there's a path there to 90%, especially now the universities are going to fully vaccinate. All students come in. That's almost 62,000 people are going to get vaccinated. In the 18 and older, we're over 80% right now. I was talking to my friend up in Vermont, the governor up there. He's approaching 85%. There's a path, and it is time, and that's what our theme is going to be. It is time. And the other piece that's going to really move this issue, I believe, is when Pfizer gets the FDA approval. That's going to be a real game changer for many, many people who are seriously saying that they didn't want to get vaccinated until there was FDA approval. That's going to happen in the next few weeks. And so we're preparing for that right now to make sure that it's really well known inside of that dwindling number at 195,000 that the FDA approval is coming now. It's coming. So we know it's coming. They're not announcing that it's coming if it's not coming. It's coming, so that's going to be an FDA-approved vaccine. I would expect the other vaccines will follow shortly after that. So that's going to really bump up the numbers quite a bit. There's many people who are, pausing because of the lack of the FDA approval. That when that comes in, our numbers are going to bounce pretty significantly.
We have time for 2 more questions.
Governor, you had until very recently been resistant to any kind of vaccine mandate. What has changed your opinion? Where you just said you're considering options for other sectors and to then require it for healthcare workers?
Well, I think in the healthcare area, after meeting with the nursing home owners and talking it through with them and understanding that they're going to support it, and also I think that the hospitals recently talked about a September 1st, right, and it was at Care New England, right, and so I think all in, it makes sense to do it, and so we're doing it. We know that, and we also know that our numbers are, significantly high in the population that it would be in nursing homes. So we're confident that that with the right precautions that we're not going to put our nursing home people at risk. Remember that 80 and older was our #1 death rate of the 2,700. And remember, this is the other piece I would say too here. So on the year anniversary, which was a day before I was sworn in, we reached 2,500 deaths in the state of Rhode Island. 5 months later, again, every life matters, right? But we haven't got to 2,800 yet. So we're on a pace that's significantly less than where we were at the pace when I was sworn in. So we're going to do everything we can to keep people safe. And I think working with the Department of Health and working with the nursing homes and the hospitals, we believe that that's an appropriate measure to take, and is to mandate the staff people that work in the facilities that take care of the people who are in that age group in particular, that they get vaccinated.
How close are you to a mandate for state workers in general on vaccines?
On a 1 to 10? Oh, maybe a 5. But the conversation's still going on.
Dr. Alexander Scott, since we haven't seen you in a while, I know the governor again has been resistant to reimposing mask mandates, going back on restrictions. From a public health mask mandates, and that's why the approach is to strongly recommend as you're wearing a mask?
Well, we like to align with what the CDC recommends, and they came out with the recommendation, probably taking into account some of what you just shared. And we want to just continue to make sure everyone has the information at their fingertips of what's critical, what's going to make a difference in protecting their families, protecting their loved ones. So continuing forward with that recommendation, it's been an approach that has worked well for us overall, through the years, making sure people are informed, educated, and equipped to make the right decisions. And so we want to continue to align with that.
From a public health perspective, would it be more helpful to reimpose a mask mandate? Would that cut the numbers?
What is key is making sure as many people are vaccinated as possible. The masking piece is a next layer of protection. The primary one is masking. And so the work that we're doing with employers to help them in supporting policies that really advance that for their staff and for the patrons that they have and care for is a key. And then having the subsequent mitigation steps that we know are also effective, and making sure that people are educated on how successful they can be in reinforcing what we want to be done with vaccination, masking, distancing, ventilation being strong, helping to ensure hand washing, all of the steps that can work are put in place wherever possible.
Thank you. Last question back here.
Thank you. Dr. Alexander Scott, how confident are you in the early warning system we have in place in Rhode Island for genomic testing to detect variants as they arise? And I understand, of course, we only have the resources to test a very small sample for genomic sequencing. But I assume, going by the experience of other states and nationally, when we estimate, say, what is the prevalence of Lambda, of Delta in the state, but then we don't know, say, what's the prevalence of Lambda. And how long do you think the lead time will be? Is it going to be 2 weeks, 4 weeks, 8 weeks before we know where we stand if we start to get into a problem like that?
Well, we know for sure that the Delta variant is continuing to be predominant. In terms of the confidence, we have the same RIDO State Health Laboratory that really was our lead in initiating the response to COVID here in Rhode Island. That same leadership has worked in building from scratch our genomic sequencing program here in Rhode Island. And they have done a phenomenal job under the leadership of Dr. Eva King since the beginning and even now. As our RIDO State Health Laboratories, we have expanded the program to the point of being able to test any specimen that we're able to access to assess for genomic sequencing. So we are among the better states in understanding what our data is showing and having our internal capacity for doing it and the quickest turnaround time that we can build, while also partnering with our academic partners, our state neighbors, and others. We will continue to do whatever it takes to ensure we have the data and the information and can relay that to Rhode Islanders so that you can be confident in making the decisions that are best for your families.
What percentage of positive test samples are genomically sequenced in Rhode Island?
We can get the exact data, but we are looking to have that done for every specimen that we can genomically sequence at this point. So it's not every test that's done, but once we have the specimen, we have built out the program so that we can test everyone that we have for genomic sequencing.